when the pandemic hit, suddenly we were faced with sort of the unknown and this sense of sort of dislocation. And we had just come out of a project dealing with forced migration, and here we were kind of experiencing this in the entire planet, including the Western world. And I think for us, what has been interesting with art in general is that it can be a tool for us to maybe come closer to themes that strike our lives or the zeitgeist that we live on, to maybe understand it better, or to kind of squash your own fears. So as much as this body of work maybe is, it's a personal thing for us, for Nina and I think to have handled this time was to maybe get closer to what it was that we were dealing with. You were aware of it, but then maybe not physically experiencing any of the results of COVID. And because we had this sort of limbo time, Nina and I felt that maybe it'd be interesting to try and just do a really very short project where we would try and mirror this period that we were living in through one of our artworks. And so rather than doing one of these huge, series of multiple images and this long research period, we decided we were just going to do one image and basically go to the source, the front line of working with healthcare workers who were in the ICU that were touched by the pandemic.
Like many of our projects, it kind of happens in different stages. So in the first stage, we actually went to the hospital, where the COVID patients are treated. And we went through the different stages, like what happens if you come there and you think you have COVID, what happens when you get really taken into the hospital and until the IVA. We also talked to a lot of the nurses that were working there to see also maybe feel out the base of their feelings and their emotions. And so after these kind of small, really short interviews, because of course you don't have a lot of time with them, we kind of went back here to the studio and discussed about how can we visualize their struggle and what they're going through. And also, like Sarah said, there was a huge openness from the staff, both from the management of the hospital, but also from the nurses themselves to be part of this artwork.